Welcome to this episode of Orthodontics in Interview. I'm delighted to bring you Simon Graf. Simon, thank you so much for joining us.
Very welcome. Thanks for the honor to invite me. I feel really honored to participate at your orthodontic interview.
Thank you so much, Simon. So I got to tell you guys about Simon. One is that I've watched him lecture a number of times, and I love his lectures. His approach to looking at digital technology is so passionate, and I'm really grateful for him to join us today. So about Simon. So he's based in Switzerland, in Bern. I've got to be clear. Simon is the youngest looking orthodontist I know. And I don't know what he uses, but after today's interview, I will be buying it. So Simon is not only a young looking orthodontist, he's also an innovator in orthodontics. He's a contributor to research and a specialist orthodontist. He qualified in 2012 from Basel in Switzerland. So Simon works in private practice, and in 2014, he developed a CAD-CAM procedure for 3D printing of metal items for rapid maxillary expansion. He's had a series of publications now. The two main ones have been in the AJODO, and he's got a new one coming out in the middle of next year. Simon is impressive. And one of those things is that he's lectured 61 times since 2016 on this topic. It's an incredible number and a massive achievement to get information out there, and it shows his passion for the topic. Simon, thank you again for joining us.
Very welcome. I'm impressed that you actually count my lectures.
Well, if you attend them all, it's one of those things. So, Simon, I think the first question I've got to ask you is, what got you into 3D printing and design? How did this begin for you?
So, the question is more, what was the background? The background was in 2009, at the University of Basel, I had the chance to get my hands on the name was iCAD, the iTero scanner, actually the first one, where you had to hold the scanner in the mouth to hold still and make a picture with the foot pedal. And then you stitch one picture to the other. And it took 45 minutes for one job. But in that moment for me, it was clear, we need to go there. That was like, that's what we need to have. Then 2013, when I was still planning my clinic, I got my hands on the Tri-Shape Trios 2 scanner, and I noticed that was the first time I actually can use one really fluently. So for me, it was clear I have to integrate it right away in my clinic. 2014, February, my first crossbite patient, I was scanning so happily, but there was no technician that was able to work with the STL file. There was no one. Luckily, the two guys that helped me with the 3D scanner, they were a CAD-CAM technician for crown and bridges. So then we sit together and let's try to do orthodontics. Instead of a crown or bridge coming out in the end, then an orthodontic appliance is coming out. So actually a need pushed me to start doing this. There's always a reason like this is most behind everything. So either I should have to go back and buy alternate and do the classic old-fashioned style. I don't know, alternate, 1830 or something like this was invented. I'm not sure. So I really thought, no way. There's no way going back. So I had to do something. And that's how everything started. And it got me really curious. I'm always really curious about high tech and new things. And from that moment on, I think it was like the tiny drop that crashed the barrel, and then from that moment on, I was really like eager and into this, and let's see what else can we make better and easier. For me, high tech innovation is only reasonable when it makes everything easier and faster and better. And now, as I see, almost everyone is now printing their rapid pulse expansion devices. So I think I did the right thing. Still, sorry to say that, I'm still a bit better because most of my friends are still printing the cast and then testing the appliance on top. So I really don't do that. I just get the appliance delivered. There was never a cast. So I think I'm still a bit advanced.
Simon, when you started that, at the beginning, it must have been so time consuming. But at the end, you still knew it would lead to greater efficiency. So how did you manage to just stay patient with the process, considering the time it takes to develop this idea?
At the beginning of my clinic, I start from scratch. I started in the green field. There was no patient. I had 2 to 3 patients a week.
Oh wow.
I was working for sure in other clinics to get the money, so to keep my clinic running. But I had time to test, and I had time to make new procedure, new protocols. But I also don't have so many patients, so I usually had to tell them, this is new, can fall out. So sometimes the rapid pulse expansion fell out 3 times. I was getting back the data, for the EPOS lecture. I was checking all my failures. I'm amazed that this patient really got stuck with me and stayed with me. But there was so I had a lot of time, and nowadays my clinic is blowing apart. So, but I try to take the time, and I use the time when I travel to a lecture or to think of it. So it's always, I think, as orthodontics is my hobby, it's not time consuming for me. It's usually, I always have time, and I always have in the back of my head when I hear something, then I already think, maybe I can do this and this. So it's always here, I think. So I always have time for something that I'm curious about, I'm motivated about.
Yeah, I think it's a sign of an expert, really. The ability to one create space in their mind to think about something, and two is even when life is so busy, you're still able to create that space to carry on having those progressive thoughts. I think it's testimony to why you are who you are. I think it's great. Simon, I want to touch on your publication on the AJODO, where you spoke about rapid maxillary expansion and 3D printing associated with it. And the question really about expansion for our patients, do you think it should be part of routine treatment for our patients or related to specific situation?
That's quite a specific question. So when I started my orthodontic profession, I was into orthodontics already as a dental student. So in dentistry, undergraduate dentistry, I was able to go and work in holidays with my orthodontist. So when I had my rest. So there was quite routine to extract the kid and baby canines in a case where the laterals have no space. So for me, that is a sign to expand, to avoid extraction of the baby canine. Because usually when you extract the baby canine, sooner or later you will have to extract one of the permanent premolars.
Mm.
And of course, crossbite and the shift when they have to bite like this. That's the main reason for me to expand. I would not say as a regular expansion. I think there is the HAO, from the AO, the white paper about expansion and airways. I would never ever promise my patient that I will make their airways better with expanding their kit. So I mainly, my hands in my clinic, I expand when I see lack of space for the laterals, crossbite, lateral shift. These are my protocols when I do expansion. Otherwise, I usually don't recommend expansion.
Okay.
And even though sometimes if I expand, I still extract teeth if there's still not enough space. Sorry.
I think that's really good to hear from yourself because there are those notions that you expand and then therefore don't extract, like expansion solved all the problems. But it's great to see that you have a mix of the two and you're using it where you feel it's clinically indicated, but not to solve all problems as well, like solving sleep and depression and weight gain and all those other fantastic ideas. Simon, one of the questions I've got, you've spoken about your use of rapid mixed. I'm interested to know what is the digital workflow of patients who come into your practice? What do they experience when it comes to digital side of orthodontics?
So it's actually from the patient side is not such a big difference than before. Usually I see them the first time, I talk with them, and I think as everybody that has done some patients knows quite quick how he wants to treat this specific patient. So when I have this idea in mind, then I usually show them some cases. Then I tell them, look, Fred was actually looking like you almost. And then I tell them, look, now you go home, you think about it. If you want to do it, it's orthodontics, in my point of view, is always voluntarily. I don't never ever force them. I don't tell them, your kid will have this and this problem. I never do that. I tell them, if you want to do it with me, please feel free and come to me. If you don't want to do it, if you don't want to do it with me, I don't mind. Please feel free. Then when I come back, I do records with 3D scan, of course. I show them right away on the 3D scan because it's really nice to see. And when they see that, they can see the whole jaw turning around. They tell them, look, look, now Fred, you remember Fred was exactly what we see now here. And then from this moment on, they don't need to come back again for separation for molar bands or something like this. So the next time when they come, I tell them, look, the next time we have this high-tech device for you right away. So I do save like 1 or 2 appointments for the patient. Actually, no, wait. Separation, adaptation of the bands, impression, separation again. So maybe up to 3 appointments. For some orthodontists that have like 20 or more chairs, I don't know, it's maybe scary to have less appointments. For me, it's a sign of more efficiency. So my patient, when the patient is coming here, there is something going on that is really bringing something to the patient. So that's efficiency. I can really schedule really perfectly every step. So I think that's the biggest part of digitalization in our orthodontic in the clinics.
That's some interesting. That's interesting, and I want to kind of explore that a little bit further with you. So, we've spoken about scanning and the digital printing, and I know you're somebody who's always thinking of the next idea. So, where do you think what's going to happen next in orthodontics? What's going to be the next digital thing to change our clinical practice? Do you think?
Right now, at the moment, I take a panoramic X-ray. I take regularly a CEF. I make pictures, intraoral, extraoral pictures. I make an intraoral scan. If we can match this all together at once, I think that would be the next step. When you have a low dose CBCT integrating with stereographic pictures, so the patient will not come for all these steps. He will come for like 1 minute, stamp the CBCT, everything is done, he's leaving, and I'm able to take out the material. I'm able to take out the intraoral scan, to take out the pictures, to take out the CEF and the panoramic X-ray, plus other interesting data we need. That will be the next step for me.
That's interesting. So getting more information from patients, but actually syncing it all together.
In
I
a
think
shorter time.
Yeah, I think it's interesting that at the moment it's as though the orthodontist has to interpret each one of these different almost disciplines of looking at a panogram, looking at a KEF, looking at models, and then we have to make that calculation. And of course, we have limits as people, and some people have more experience. But if that was all together, if we had a set of values then to ideally work towards for that patient, that would be amazing. And we could then break it down as to what that does to the patient overall. With digital technology, and you've spoken about reducing appointment times, but also the idea of being able to monitor patients is now coming onto the stage. Do you think virtually monitoring patients is a good thing for clinical practice, or do you think actually it could result in less attention being paid to patients? We're not seeing them clinically, therefore we don't have the full information. Where do you see monitoring happening from a digital side?
I'm quite sure that this virtual digital monitoring will be a part in our orthodontic future. I'm not sure actually if it's for the good for us or not. For the patient, of course.
Yes.
We are all facing now these do-it-yourself orthodontic companies, and I think in the near future, probably like this virtual care will take over, and for some things, to be honest with you, we are not needed anymore. So I think that many parts, if the patient is making a virtual checkup and doesn't need us face to face, and then maybe some kind of AI algorithm will take care of this and will evaluate this and then just send us a message, okay, patient is good.
Mm-hmm.
So this information can be done, can then be checked by the receptionist and then see, okay, aligner is good, no need to see the orthodontist. So we are actually reducing our work.
Yes. Yes.
I'm sure we cannot stop it. I'm sure it is for the patient good, because in my area, even though I'm almost on the countryside from Switzerland, I see my patient, they don't have time. They don't have time to come to me. Everything else is more important than to come to me. So I'm happy for everything when I can reduce chair time,
Yeah.
but it's also scary when we have no more patients here. How can we make them a living? How in Switzerland we can charge per action we do on the patient? So there is no way we can charge for a virtual consultation. In other countries, maybe this is already ready and implemented, but in Switzerland it's difficult. So I think we need to find a way how to implement this so we can make it still a living.
That's that is a sign of a true innovator. That this technology could result in you having less patience, less money, but actually still wants to integrate it into his life. Shows perhaps why innovators have challenging times, eh? But that's really interesting to hear, and I do hope it does go in that direction where we are able to adopt and enhance our patient's experience through technology and not resist it. Because as we've seen, perhaps then other companies will then find another avenue to take advantage of it. Obviously, Simon, you are the tech person, so I've got to ask: Are you a Windows chap or are you a Mac person?
So smartphone and Steve Jobs
Okay,
guy. I have
okay,
an iPhone.
okay.
But otherwise, I use Microsoft because everything network based, most dental softwares are just Microsoft. And I don't know if you ever used Parallels on an Apple computer. Usually, something is a bit gets stuck. So I'm too lazy for this. I know Apple computers are so pretty, but I
Yes,
have now this. I have this Microsoft Surface Studio. All in one computer. I'm really happy. So it's just easier to do everything on Microsoft. The workflow is easier. Everything is connected easier.
yeah,
I'm too lazy for problems like this.
okay. Do you know what? It shows you I'm on the opposite side because I've got a Mac laptop and I've got an Android phone. And what I do is that my laptop is pretty. I can't do a great deal with it. I spend ages doing settings on my phone, which doesn't really help me in my life anyway. So I mean, I waste my time in that respect. Simon, talking about phones, there's a picture of you on Instagram. And guys, if you haven't seen this, check out Simon on Instagram. So he's got a picture of himself on a ski slope with a ski gear, holding the biggest drill I've ever seen, smiling with no comments on. What was going on, Simon? Why was that situation of ever
So
thing that took place?
for ski racing, if you want to put this pose where they make like slalom and super G and all this, you need to have like a huge drill that you can drill in the snow, then to fix the poles in the ground. So
Okay.
that actually really holds. And to be honest, in that moment, I told you already, the patient don't have time to come in anymore.
Yes.
Everything else, is more important. School, soccer, the child birthday from the neighbor, and they tell me, I like at 7 in the evening we can come to you. So, and I was really mad. So I was like, if you don't come, we have really the big device to scare all the people away. So that was the motivation behind. And I just saw the thing laying on the slope side, so I had to grab it and to make like a selfie. Yeah,
Guys, that's a way to encourage your patients to wear the rubber bands. Just have a drill. Say if it's
yeah,
not the elastic,
it's a drill, you
it's
know.
Simon's drill. Simon's drill. We're going to borrow it. He uses it. We have a picture. That's great to know the background story to it. Simon, coming back to orthodontics, I mean, you are an innovator, but it's interesting to know what you and who you've looked up to. So, who's it in orthodontics that you have admired in your journey?
Um, I think even though my own orthodontist, he was also a really difficult person, but he was charismatic, and he was able, even as a kid when I had my braces, he was able to fascinate me. He was able to take me with him. So I really started orthodontics because also of him. And I went to work at his place, and he showed me so many things. He teach me. For every new patient I had to put brackets, I had first to take the cast, draw in where I want to put the brackets, and I had to go to show him. So I had an incredible training with him. So I think he's one I admire a lot. Then I admire people like, for me, the really the as he says, the last frontier is retention. So Simon Littlewood is one really of my heroes, and he's really he got his publication Cochrane Review. Come on, how can you do that? So I think he's certainly one. Of course, Björn Ludwig, Benedict Wilmes, they influenced me a lot. I'm really thankful for the mini implant things that Bertie Melson was doing. And also, of course, we can never forget the growth things, the growth from Björkskeller. That is so important for me. I tell all my patients, you don't stop growing. You don't stop with 20, we can take out retention device. No, leave them in. If it keeps on moving one day, you come back. So these are like the things that I think that influenced me a lot and helped me a lot on my way, and give me a lot of opportunities also to avoid mistakes.
Yes.
So when I see somebody else did that mistake for me already,
yes.
I don't need to repeat it.
Yes, yes. And Simon Littlewood, I mean, he's been on this podcast. He's just the nicest guy as well. So I mean, he's just wonderful. Last bit now, bringing the interview to a close, Simon. What one piece of advice would you give to the orthodontists out there?
Don't give up. Integrate, embrace new technology. We cannot stop it. It's just not possible. We just need to find a way to integrate it, to adopt it. Even though maybe it's a bit scary, as I said, but we cannot stop it. That's just the point. And still have fun with it. Don't do your job because of the money. Then you always lose. If it's your hobby, your passion, how do you say that?
Passion.
Is your passion? Yeah, exactly. Thanks. I was missing the word. If it's your passion, then you will have never waste the day, and you will always go happy from work. That's my piece of advice.
That's amazing. Thank you, Simon, for joining me again for this conversation. I really enjoyed chatting to you, buddy. And I shall speak to you soon. Take care, my friend.
Thank you. Bye.
Thank you so much. And for the guys who are listening to this interview and watching it, please do subscribe and look forward to the next episode. Just a few outtakes, guys, from today's episode. I hope you do enjoy it. Simon, I had an idea. It's of a digital design that we can work on. It's essentially an expansion device, digitally printed, but it's got my name written on it. What do you think?
I think when your name is from like a famous rapper, you can even put it on the incisors, We can do that. Absolutely.
Excellent. So Simon, I'm going to carry on working on this idea on a completely separate topic. Can I actually just get the password to your laptop? Is that okay?
Sure. The password is Farooq. The interview is over.